we are going to take a chest X-ray for a patient. Okay, so there are several views. Common view is a PA view, posterior-anterior view, and anterior-posterior view also will be taken for patient if the patient is having any difficulty in breathing. Okay, next lateral view. Lateral view is taken to see the lateral ribs of the patient. Okay, so three major views will be taken. Okay, so I need a student for demonstration. Consider this wall as the chest stump. Okay, so the patient will be facing the chest stand in PA position. Okay, for posterior anterior position, the patient will be facing the chest stand. Okay, so we have the patient should be in close contact with the chest stand, and the patient's hand should be vertically rotated at the back side. Okay, so the patient hand should be in the air, and the patient chin should be lightly raised. Okay, and we have to insist the patient to keep a full breath hold until we close the exposure. Okay, so we have to for what purpose breath hold projection is taken in a sense. So when the patient is in normal respiration position, so we will be having an immobilization in the views. Okay, so when the patient is in breath hold position, the diaphragm or else the chest lungs will be still, it will get immobilized. So there will not be any artifacts or any it will not cause any motion artifacts. So we have to insist the patient to be in breath hold position until the exposure gets over. Okay, so this is the common basic projection which is known as PA projection, which is used to visualize a patient's heart, lung, trachea, trachea, and the rest of the patient will get fully visualized. Okay, for this position, the exposure factor will be for kV 60 to 70 kV will be given, and MAS 20 to 25 MAS will be given. This is the common basic projection of chest X-ray. Okay, posterior anterior projection. View is anterior posterior projection. For anterior posterior projection, the patient will be facing the X-ray tube. The patient, the X-ray tube will be in front side of the patient, and the chest stand will be at the back side of the patient. Okay, the patient has to be like the PA projection of the patient was standing in the close contact with the chest stand. As like that in AP projection also, the patient has to be in contact with the chest stand. Okay, so the patient will be in close contact with the chest stand, and his hands will be either it is extended or else it is vertically rotated at the back side. Okay, so same in the PA projection of the patient's hand are kept. So in the same projection, the patient's hand should be positioned at the hip, and the patient has to slightly raise their chin up, and the patient has to be insisted to be in breath hold position. Okay, so in breath hold position, we have to expose until exposure is completed fully. The patient should be in breath hold position. Okay, so we have to insist the patient. In case if any female patient is coming, so we have to tell the patient to put the hand up. Okay, so for what purpose we have to instruct the patient to put the hand up in a sense. So the patient hair will be thickened or it will be breathed. Okay, so while we are taking the AP projection of PA projection, so when the patient's hair is in a normal, so if the patient didn't put up their hair, the vertebral column will get overlapped by the patient's hair. So we have to insert the patient when the patient is getting inside the X-ray room. So we have to instruct the patient to. The third projection is lateral projection. Okay, so lateral projection is mainly taken to the patient who comes with RTA. If any road traffic accident, RTA is nothing but road traffic accident. If in accident, if the patient has any injury in their ribs, so for that purpose they will be taking lateral projection. Okay, so how that fracture is being indicated in the patient. For that purpose, lateral projection is taken, and to identify the lung nodes, lateral projection is taken, and if the patient is having any pleural effusion also, lateral projection will be taken. Okay, so let's see how for lateral projection how we are going to position the patient. Okay, so for AP projection, we have seen the patient have to face the X-ray tube, and for PA projection, we have seen the patient will be facing the chest stand. But for lateral projection, the patient have to face the the wall. Okay, so the patient have to stand in the lateral projection. X-ray tube will be at the right side of the patient, and the chest stand will be at the left side of the patient. Okay, so for lateral their hands above their head. Okay, so the patient have to extend their hands above their head and they can keep at the back side of their head. Okay, so this is the lateral projection, and we have to insert the patient to keep to be in breath hold position. Okay, so if the patient is in breath hold, the lateral will get fully expired, and there will not be any artifacts during the exposures. Okay, so this is one sort of procedure, one sort of positioning, and another sort of positioning. If the patient is having any fracture at either side of the ribs, either in the left side or else in the right side, we have to position in the another way. So for that projection, we have to position the patient, the patient's right hand. Either if the patient is having fracture in the left side, the patient's right hand should be extended in the front side, and the patient's left hand should be extended at the back side. Okay, so the patient will be in this position, and we have to ensure before exposing that the patient is not an oblique, patient's body is not an oblique projection. Okay, so we have to ensure that the patient's body should be laterally perpendicular to the image receptor. So we have to ensure whether the patient is a true lateral projection. Okay, if the patient is in true lateral projection only, we can easily identify the fracture. Either if the patient's body is being turned obliquely, we cannot accurately identify the fracture, how depth it has been occurred. So we have to ensure before exposing. Whenever we are exposing, we have to ensure whether in lateral projections alone, we have to ensure whether the patient is in true lateral projection or not. So this is how, if the patient is having fracture on either side, so this is how the position will be taken. Okay, the same KB and MAS will be given for the lateral projection also. The patient will be in inspiration. After exposing, we can ask the patient to be in a normal projection. Okay, a normal position. Okay, so we have to insert the female patient to put their hair up. Okay, so before that, either it is female patient or male patient, we have to instruct them to change into the hospital gown. They have to remove their own clothing and they have to change into hospital gown. And if any female patient come, we have to instruct them to remove all the metal objects from their body. Okay, so if any metal objects is being in the patient's body, it will cause artifact, and it will be again we have to second time we have to take the patient's X-ray. So we have to insert the patient to remove all the metal objects before exposing. Okay, so this is the main instruction we have to insert the patient. Even a safety pin will cause artifact in the image. Okay, so we have to insert the patient, remove all the metal objects, and we have to give them the hospital gown, and the patient have to change into hospital gown. After we need to position the patient. Okay.